In the quiet corners of our shared world, a silent struggle unfolds daily. Wild animals, driven by instinct, often encounter the expanding footprint of human civilization. Sometimes, these encounters turn perilous. A deer caught in a fence, a bird snared by fishing line, a coyote trapped in an industrial waste site. These aren't just unfortunate accidents, they are urgent calls for specialized intervention. This film explores the incredible, often dangerous, work of wildlife rehabilitators who answer these calls, deploying advanced techniques to free animals without causing further injury, and offering them a vital second chance at life. Human infrastructure, while essential for our lives, can become an invisible labyrinth of danger for wildlife. From discarded fishing tackle to agricultural fences, old machinery, or even simple garden netting, these objects, innocent in their design, can become deadly traps. Animals caught in such entanglements face immediate threats, lacerations, fractures, strangulation, and the insidious onset of dehydration and shock. The clock begins ticking the moment an animal is ensnared, demanding swift, skilled, and incredibly precise action from rescuers. When a call comes in, the first critical step is an immediate, remote assessment. Rescuers cannot rush in, the animal's stress level is already dangerously high. They must observe from a distance, identifying the species, estimating its size, and most importantly, evaluating the nature of the entanglement and the severity of injuries. Is it a simple snag, or a deep, constricting wound? Is the animal aggressive or lethargic? These initial observations inform the entire rescue plan, dictating the necessary tools, personnel, and approach to ensure maximum safety for both the animal and the team. The scene of an entanglement is often unpredictable. Stressed animals, especially larger mammals, can be extremely dangerous, posing risks of bites, kicks, or scratches. Rescuers adhere to strict safety protocols, often involving multiple team members to manage the animal and the entanglement simultaneously. Personal protective equipment, from puncture-resistant gloves to specialized face shields, is mandatory. The goal is to minimize distress for the animal while ensuring human safety, creating a controlled environment for what is inherently a chaotic situation. For larger, more dangerous, or highly stressed animals, chemical immobilization is often the safest and most humane approach. This specialized veterinary protocol involves administering sedatives or tranquilizers, typically via dart gun, to render the animal unconscious or deeply sedated. This allows the rescue team to work safely and efficiently, minimizing the animal's struggle and the risk of further injury during disentanglement. Precise dosage, based on species, weight, and condition, is paramount, requiring extensive veterinary knowledge to prevent adverse reactions. Darting an animal in the field is a skill honed through years of practice. It requires a steady hand, an understanding of ballistics, and the ability to accurately estimate distance and animal movement. Specialized dart guns, often powered by CO2 or compressed air, deliver the medication. The dart itself is designed to minimize trauma, often with a small barb that allows it to stay in place long enough for the drug to be injected. Every shot is calculated, aiming for muscle mass that will absorb the drug effectively without hitting vital organs or sensitive areas. Not all rescue scenarios allow for chemical immobilization. For smaller animals, or in situations where darting is impractical or unsafe, physical restraint becomes the primary method. This requires specialized equipment like catch poles, nets, and blankets, used by trained personnel to safely secure the animal. The technique must be swift and decisive to reduce stress, yet gentle enough to avoid injury. Understanding animal behavior is crucial here, anticipating their movements and reactions to ensure a controlled and quick capture, allowing for the subsequent disentanglement process. The type of entanglement dictates the tools required. Wildlife rehabilitators carry an arsenal of specialized cutting implements, heavy-duty wire cutters for fences, fine-tipped shears for fishing line, and bolt cutters for more robust materials. Each tool is chosen to make precise cuts, minimizing the time the animal is held and preventing secondary injuries from jagged edges. These aren't just hardware store tools, they are often veterinary-grade instruments, meticulously maintained for sharpness and reliability in critical moments. Speed and precision are paramount. Once the animal is safely restrained or sedated, the meticulous work of disentanglement begins. This is where expertise shines. Rescuers must carefully identify how the material is wrapped, often cutting away sections layer by layer, always aware of underlying skin, muscle, and bone. It's a delicate dance between freeing the animal and avoiding further trauma. For deeply embedded objects, veterinary oversight is essential, sometimes requiring surgical precision in the field. Every snip, every pull, is performed with the utmost care, prioritizing the animal's welfare above all else. As soon as the entanglement is removed, immediate veterinary assessment and treatment begin. This often occurs right there in the field. Wounds are cleaned, disinfected, and dressed to prevent infection. Pain medication and antibiotics may be administered. The animal's vital signs, heart rate, respiration, temperature, are closely monitored. This initial care is crucial. It stabilizes the animal, addresses immediate health concerns, and prepares it for transport to a rehabilitation facility, laying the groundwork for a successful recovery journey. After disentanglement and initial treatment, the animal isn't immediately released. If sedated, it's carefully monitored as the effects of the tranquilizer wear off. Rescuers look for any signs of distress, ensuring it breathes properly and its body temperature remains stable. They assess its ability to move, checking for hidden injuries or lasting effects of the trauma. This post-extraction monitoring phase, often lasting several minutes to an hour, ensures the animal is robust enough to be safely transported or, if deemed fit, to be released back into its habitat. If further care is needed, safe and stress-free transport to a dedicated rehabilitation center is vital. Animals are placed in appropriate carriers, sized to prevent further injury and allow for proper air circulation. Temperature control is paramount, especially for young or compromised animals. Minimized noise and sudden movements are crucial to keep stress levels low. This careful journey is often the bridge between a successful field rescue and long-term recovery, ensuring the animal arrives at the facility in the best possible condition for ongoing treatment. At the rehabilitation center, the animal receives specialized, extended care. This can involve advanced veterinary procedures, wound management, physical therapy, and nutritional support. The goal is not just healing injuries, but also ensuring the animal regains its natural instincts and strength, preparing it for life back in the wild. This intensive period can last weeks or even months, with every effort focused on preventing habituation to humans and fostering self-sufficiency, ensuring a truly successful reintroduction. The ultimate goal of every rescue and rehabilitation effort is a successful release back into the wild. This momentous occasion is the culmination of countless hours of dedicated work. Animals are released into suitable habitats, often near where they were found, ensuring they have access to familiar food sources and territories. Watching an animal, once tangled and helpless, bound back into its natural environment is a profound testament to the power of compassionate intervention and the tireless efforts of these unsung heroes. It is the ultimate measure of success. Behind every successful rescue is a team of dedicated individuals, veterinarians, technicians, and volunteers who often work under immense pressure, in challenging conditions, and at all hours. Their commitment extends beyond the immediate rescue. It's a profound understanding of ecological balance and a deep empathy for individual lives. This demanding work requires not only scientific expertise but also incredible patience, physical stamina, and an unwavering belief in the value of every single wild creature. They are the frontline defense against human-induced harm. While emergency extractions are vital, the broader goal is prevention. Education plays a crucial role, teaching communities about responsible waste disposal, proper fencing techniques, and the dangers of discarded fishing line. Simple actions, like cutting plastic rings or retrieving lost items, can significantly reduce the number of entanglements. It's a collective responsibility to coexist harmoniously with wildlife, minimizing our impact and creating environments where animals can thrive without facing these man-made perils. Prevention is the ultimate cure. Every successfully untangled animal represents more than just a life saved, it's a testament to hope, perseverance, and the critical role of specialized intervention. These rehabilitators provide a crucial safety net, constantly evolving their techniques and protocols to meet new challenges. Their work reminds us that while our presence impacts the natural world, our capacity for compassion and proactive care can mitigate the damage, allowing wildlife to continue to flourish, free from the confines of human-made hazards. The fight to save entangled and trapped land animals is ongoing. Every year, countless animals face these life-threatening situations. The expertise of wildlife rehabilitators, their specialized tools, and their evolving veterinary protocols are our best defense. They not only save individual lives but also contribute to the broader health and biodiversity of our ecosystems. Supporting these organizations and understanding their methods is crucial for anyone who values the wild inhabitants of our planet. Their work ensures that the wild remains wild, one rescue at a time.